The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk.
Welcome to the Healthy Image Podcast. Today we have our very first guest, friend of the show, huge Tar Heels fan out of Charlotte, North Carolina, 9-year breast cancer survivor, our very own Katie Robbins. Welcome, Katie.
Thank you, Veronica. I'm excited to be here. I appreciate you having me on.
We're happy to have you on. Of course, it is October, Breast Cancer Awareness Month, and I know that you are, again, a 9-year breast cancer survivor. I personally don't know your story very well, so I thought this would be a good opportunity to kind of get to know it more and maybe help spread some education, awareness for the importance of getting your screening mammogram. So do you mind sharing, how did you first come to be diagnosed with breast cancer? Is there a backstory or?
A little backstory about me. I'm in marketing and healthcare education. I've spent a lot of my career focused on breast health education. In fact, who would have thought this, but my very first role at a hospital in marketing was supporting an event for a group of OBGYNs who were doing clinical breast exams for patients for free. And a woman and her mother and her son, a little boy, came in, and the woman wanted her mother to get screened. And I said, well, being right out of school and, all ready to set the world on fire, I was like, well, you can get screened too, because, I'm trying to beef up the numbers for the event. And she's like, oh no, I'm just going to sit here with my son. I'm going to help my mom fill out her paperwork. And I was like, I'll help your mom fill out the paperwork. You fill out the paperwork and I'll sit with your son. And eventually she wouldn't take no for an answer. She probably was like, get this lady out of my hair. So she was seen and her mom was seen. Fast forward, I don't know, to the end of the day, I'm flipping through the files, getting things set up for the doctors to have a paper record for electronic medical records of what happened during the day. And I came across the one that had my handwriting for her mom. Everything looked fine. I flipped it and it was hers. And my heart just sank into my stomach. This woman had significant breast issues. She very likely had breast cancer. And something just told me she brought her mom here so that she could be sure that her mom was okay to take care of her son. I don't know what happened on the other side of all of that, but my heart sank, and lots of prayers for her, but it set a fire in my belly for being sure to always be focused on breast health education. Fast forward 20 years and I was the one being diagnosed. So normally in October, I'm the one that will get on the camera and have the TV crew there to talk about breast health education and screening mammography. And in 2015, that just wasn't the case. We had other people that wanted to come in, and the reporter wanted to do it herself to show how simple it was. So I backed off. I was like, great, you be on camera for this. Well, she ended up with as a callback. Luckily didn't have breast cancer, but probably spent about 3 days thinking she did while we were having to go back and do more tests on her. She had something called a radial star, which is not very common, but it is an increased risk for breast cancer. And I didn't want to tell her when she reached back out, hey, did you get your mammogram? That I had not gotten my screening mammogram.
She was in your spot.
I was like, this girl just went through all of this to show everybody how easy it is, and I haven't set mine up yet. So I quickly made my appointment, and I was seen in November. About 3 days later, the radiologist called me to let me know that I, in fact, had an invasive ductal carcinoma. And it ended up being something called triple negative breast cancer. I didn't know a whole lot about this side of the fence. I always thought, oh, it's so, if you have cancer, breast cancer is the one to get because it's so treatable, it's curable if you catch it early. How wrong was I, in not recognizing what patients truly go through, and all the different types of breast cancer. So the type that I had was very high risk. It was very aggressive type of breast cancer. It's common in about maybe 15% of the breast cancers that get diagnosed.
Wow.
Most of them are hormone based, so you can be HER2 positive, which is a type of growth hormone, progesterone positive, or estrogen positive for breast cancer. You can be positive for all three. You can be negative for all three, and negative for all three is one of the least common ones. With the hormone-based ones, they know what's causing it, so they can give you hormone therapies and different things in addition to, of course, surgery and radiation. And depending on how far along you are in the process, they may do chemo. But with triple negative, they don't know what's causing it. So they throw the book at it. And so I started with chemo, which shrank it from a stage 2 down to a stage 1. I was lucky enough to be able to have a lumpectomy versus a mastectomy, and then did about 33 rounds of radiation. So 9 months later, I was cancer-free.
How soon after you got diagnosed, how soon did you start treatment after that?
Less than a month later, within just a few short weeks. The first process that you go through when you do your screening mammogram, it's all covered by insurance. If you're a callback, you're no longer considered screening. You're considered diagnostic, which I think a lot of women don't realize. If they're a callback, suddenly they're having to hit that deductible or pay a deductible or a fee. It's outside of that preventive health care, which is a whole nother topic. But so I went back for my diagnostic. At that appointment, they did the biopsy. The biopsy results take about 3 or so days for the pathology to be reviewed and come back. And then it takes a few more days after that to know what type of cancer it is. Then you go in and you meet with a host of different doctors. You'll have, typically a surgeon who is kind of considered the quarterback for the plan, for the program. In my instance, I had a medical oncologist, but also a radiation oncologist. So the surgeon kind of set the tone and the plan for everything. And she got me in with the medical oncologist pretty quickly, probably within a week or so after seeing her. And within a week or two of that, I started chemo. I went through 16 rounds, lost my hair. It was kind of crazy. But also kind of nice to not have to shave for a little while. I'm not going to lie. But it was interesting. So yeah, it all moved pretty quickly. So.
And I know this about you, but you have a family, a husband and 2 daughters. How did they handle it? I'm sure it was pretty traumatic for everybody.
It was a lot. When I was first diagnosed, and we didn't know what type it was, my husband was very supportive, and I know he was taking it kind of hard. It's always hard to be the caretaker. And we sat the girls down at dinner and we chatted with them. And my oldest is a very emotional. She was middle school at the time, and she burst into tears. I mean, just like the floodworks had opened up, and like, it's going to be okay. It's going to be all right. My youngest was like having none of this emotion. She was like, I am out the door. And this is my child who never wants to go to school. She was like, can I go do my homework now? So up the stairs she ran. The next week, when we found out what type it was and knew that I was going to have chemo, we sat the girls down again. And so the youngest, she was kind of at the end of her elementary school years. She had lots of questions about the chemo. It was cute. She, funny story, she was like, Mom, so chemo, you're going to lose your hair, aren't you? And I said, yep. She thought for a second. She said, "Are you going to lose your arm hair?" And I said, "Yeah, I am. I'm going to lose my arm hair." She thought again for a second. She said, "Mom, are you going to lose your nose hair?" Yeah, I think I will. And you do. In fact, you do. She looked at me, eyes big as quarters, just like, "Mom, are you going to lose your chick fuzz?" And I looked at her and said, "Abigail Scott Robbins, what is chick fuzz?" And she goes, Mom, the hair above your lip."
Oh my gosh.
I died. I said, "Yes, I'm going to lose the hair above my lip, and I hope it never grows back."
Yeah, that's one way to get rid of it, right?
I could live without that forever. So,
Oh my gosh. It kind of goes to show, I mean, obviously they knew, they had an idea of what was, you were going to go through and the severity of it, but I mean, they really didn't know the severity of it. Like the fact that she was thinking about your hair loss, which honestly I'm sure you probably thought about too.
I did.
But it's like, you know what, such like blissful ignorance in a way. Like if that's what you're going to be worried about, then let's you just worry about my hair situation.
And today my girls are all grown up and they are acutely aware of their breast health.
Yep.
Spent a lot of years with education, teaching women and teenage girls how to do self breast exams, how to be aware of their breast changes and their body changes, and being comfortable telling someone if they experience a change. But even beyond that, when you have a family history, which I had no family history, I think this is important to note. I had no family history. Most women don't. 85% of women, 80 to 85% of women who are diagnosed have no family history. And so it's just the two biggest risk factors are being a woman and getting older. But then when you throw in a risk factor into the mix, like family history, you suddenly have to really think more aggressively about, when do I start my screening mammogram routine? And so I was 42 years old, which is considered young.
Mhm.
Still very young, but that's considered young in mammogram world and breast cancer world. So my girls will start their screening mammograms at least by the age of 32. And if there's any concern from the doctors that there's any other risk factors that they may display at that point, they may even start sooner than that.
Yeah.
So
Is there something you tell your daughters, like what do you tell them to look for, or like symptoms to feel around for? Have you educated them on that?
yes. So, anytime that you see a change in your body anywhere, but in your breast tissue, in particular, you want to alert your doctor to that. And by changes, I mean like suddenly you're having discharge. You have an area that's red that's suddenly different. You have the nipples starting to kind of pull back oddly, or an area of your breast that starts to kind of uh, pull inward some, almost like it's an indentation. If you're feeling something that feels like a rock, or a tiny pebble or a tiny grain of sand, or an area where you feel several little tiny areas that feel like sand under your breast tissue, it's always good to talk to your doctor. But that's also why we say, look at your breasts on a regular basis. You're getting in the shower, you get out of the shower, look in the mirror so that you know when something looks different. Do your self breast exams monthly so that you can tell when something is different. All of us ladies have lumpy, bumpy breasts. There's just no getting around that. And so, understanding that sometimes it's our cycle, sometimes it's, just a different medication or something that we're on that's causing our breast tissue to maybe be a little more bumpy or lumpy, is something to pay attention to. So,
Yeah.
you know, same time of the month is usually a good time to do it. Usually, before your cycle, a few days before your cycle, and paying attention to it.
Then you start to know, like, wait, I feel something, but you know that that's something you feel is normal for you. Like that's like,
Right.
Some women have dense breasts, like you said, lumpy. I mean, you'll know what is normal for you. So then when you're doing your self exam, you're like, wait a minute, I don't remember that being there before. Then it's like, okay, let me ask my doctor about it. Of course,
Yeah.
when you first start to do your self exams, if you feel something, don't wait to find out if it's normal. Go see your doctor. I remember I went for um I thought I felt a lump in my breast, and it was like sore. It was like kind of under my arm, and of course I'm in this field too, so I knew a little bit about it. I was newer to the world of radiology, so I didn't know as much as I do now. But I just remember, of course, automatically I'm like, oh my gosh, I have breast cancer. I'm only, I'm not even 30. Like that's where my mind went. So I called my doctor and I go in, and I was so nervous, but opened up my gown, and she's doing an exam on me, and she goes, okay, so I don't feel any lumps. She, didn't feel anything, and I'm like, right there, that's where it hurts. I feel it right there. And she goes, have you started doing anything new, or anything out of the ordinary? I'm like, no, nothing, nothing new. I don't work out, like, I couldn't have done anything strenuous. And then she looks over at my purse, and I had this massive tote bag, because I had started taking the train to work. Now, to me, I didn't think that was like something that
Related to your breast
yeah, so I'm like, yeah, I take the train, like, so she's like, is that your bag? I'm like, yeah. And I'm like, I use it because I take the train to work. And she's like, this thing is massive. It was so heavy. I had like all my stuff in it, my laptop, like all of my work things. And she's like, you have a strained muscle. Like, this is nothing to be concerned about. And at the time, I felt so silly because I'm like, covering myself back up, like, oh my gosh, I felt so exposed. And then I was like, you know what? But now I know. And if I hadn't have gone in and her tell me that I had a strained muscle, I would have been a mess. And I called right away, like, I think I have breast cancer because I have pain, and and at the time I'm like, I could have sworn I felt a lump. But again, I wasn't doing self exams regularly because I didn't know any better. And it was probably because of my cycle. And, it's like, but I think it's like, learn what's normal for you, so that way when something is out of the ordinary, to get it checked, and don't be afraid to go get it checked.
That's
Let them tell you it's nothing.
yeah.
It's like, it's nothing until it's something. Let your doctor tell you, let them refer you. um I know for us, and maybe you can kind of speak more onto this too, being in the radiology marketing world, but it used to be a lot easier to go get a mammogram.
Wow.
Nowadays it's it's a little bit harder now, and it's something that the whole country is dealing with. There's this shortage of breast radiologists, mammotechs, like, just, it's kind of the perfect storm. um have you experienced that with?
Yes, 100%. And I think it's important. We cannot shortchange ourselves. When something isn't right, don't shortchange yourself. You spend a lot of money for your insurance and your health care. Go get checked out for sure. If there's a delay in getting your care and you're concerned, talk to your doctor and see what other options you have. We have all this technology today where you can message your doctor. You can, you know, even do online telehealth with certain doctors for things. Like, there's no reason for us to shortchange ourselves. But it's also important to understand the situation in the healthcare world right now. And it's not just radiology, but radiology is definitely feeling, I think, a big brunt of it. There were, and this was a couple years ago, and I believe it's probably still the case, if not worse, there are roughly 1,000 radiologist physician positions available that cannot be filled across this country. So we're short 1,000 doctors at least across the country in just radiology. So imagine what that looks like in some of the other specialties of medicine. And the tricky thing about radiology is that's a specialty in and of itself, but there's subspecialties within it. So the breast health subspecialty seems to be even harder to get those positions filled for. A lot of doctors don't realize that, when they're referring someone in for an imaging study, if they're not paying attention, it could just be a regular run-of-the-mill radiologist that's just doing typical diagnostic radiology work. But you have the option to have it subspecialty read. Have your patient at a facility that has subspecialized doctors who are specialized in pediatric radiology or musculoskeletal radiology, or the body radiology, which one might think is your body, but really for them, it's like the chest, abdomen area. There are cardiology radiologists who are really focused on the cardiovascular system. There's neuroradiologists, and there's breast radiologists. And those breast doctors, I mean, when they're looking at your breast tissue, they're looking for abnormalities that other less trained doctors might not ever see. And that was kind of the case for me. Had I not gone in for a 3D mammogram that is much better at looking at dense tissue, and hadn't seen a subspecialized radiologist, I might not be sitting here today. It was just huge that those two combinations were in my favor when I had my mammogram. Even the technologist who looked at it that I knew on the back side of this was talking with them. They were like, I can't believe that she spotted that change.
Really?
It wasn't there last year, but it was there, and it was aggressively growing. And it was hard to see even on the mammogram. The ultrasound showed it a little better. The breast MRI showed it even more. And that was all, a part of that journey, and leading into getting the chemo, all of those extra steps, but it also helped the doctors develop a treatment plan. But none of that would have been possible had it not been for a subspecialized breast imager who was able to say, that looks off. That's different from last year. And to talk about a 3D mammogram, a mammogram on a screen for a doctor to look at is like looking at a bunch of clouds in the sky, for example. It's like a cloudy day. There's all this white tissue, and it's hard to figure out what the little black dots and the nuances are there. So if you think of it like a plane flying through the clouds, 3D mammography allows the doctors to kind of go through the image slice by slice by slice by slice, so they can really see such a better angle of all your breast tissue to really identify those unique abnormalities that are there.
So you said the year prior you had nothing, everything was clear. Then the next year, and you were a little late on it too, the next year is when it was, tiny.
It was there. Yeah, it was tiny.
What would have happened? I mean, we will never know what would have happened, but if you would have skipped a year, because I know there's some places that recommend every other year for your mammogram. What would that have looked like for you?
I wouldn't be here.
Because it was just that aggressive.
Yeah. My friend, a very dear friend of mine, went through the exact same situation almost as me, only she wasn't on a screening mammogram. She had found a lump, and hers turned out to be a breast cancer. When she went to the doctor and she found the lump, they diagnosed her, and it was a triple negative, and she beat it the first round. But the problem with triple negative is it has a pretty significant chance of coming back. And so they say once you hit the 5-year mark, you're kind of home free. So I'm 9 years out, I'm feeling pretty good. By year 2 or 3, hers had come back, and it usually comes back in the bones or the lungs or the brain. And hers had come back in her bones and in her lungs. And she did not survive it. And it was devastating. I was so upset. As soon as I found out that it had come back, I kind of, know enough for it to be dangerous. And so I was like, I know enough to know where this is headed. But there's so many research studies out. There are so many people doing research, and so much of it is computer driven today. But the gold standard research is when you can have a true person for a number of years going through the research program to determine the success. That's gold standard research. And they did this type of research in Sweden. A study, I forget the name of it, but there's a study there that looked at women over the course of, I think it's like 20 years to determine the benefit of mammography. And they said the best benefit, the biggest chance of life years saved is when a woman starts getting her mammogram at age 40 and goes every year annually. Any woman that's at high risk needs to talk to the doctor about going before 40, and may even need to balance it with a breast MRI or a screening breast ultrasound on the 6 months off, so every 6 months they have an ultrasound or an MR, and then on the other 6 month window, they're having their mammogram. But there's, when this all started to change, it was around the year that I was diagnosed, in 2015. Well, I take that back even a little further. 2009, the United States Preventative Services Task Force came to the table and said we should start mammograms at 50 and go every other year. And they could not have been more wrong. I mean, just wrong. And it laid the groundwork for potentially for insurance to not cover us. During that time frame, Obama was in office, and they set forth legislation that demanded that insurance companies continue to cover mammography every year starting at 40. So that has continued, but there was such an outcry from women and doctors that passed through. Well, fast forward to 2015, and the American Cancer Society decided to change some of their recommendations, and theirs got even a little more complicated. And the news media is going, hey, there's all these people are paying attention to breast health stories. Let's run everyone that comes through the door because it's good for ratings, right? Like it's a hot topic. It's a hot button for people. So it's gotten a lot of press, some of which is probably good, some of which probably isn't. But the reality is, if you understand about research and gold standard research, the most lives saved will be when a woman goes at 40 every single year. I cannot stress it enough. And I wouldn't be sitting here. And I realize that that's probably a lot of unnecessary screening for some people, but isn't my life worth it?
What would
Isn't
you
another
say?
life worth it?
What would you say to somebody who says, because I have heard people say this to me before, because I'll tell them, have you got your screening mammogram yet? And they'll say to me, mammograms cause cancer. There's radiation in mammography. Mammograms cause cancer.
Yeah.
I mean, what would you say to somebody who says
I
that?
would say if you are concerned about the radiation that comes from a mammogram, please don't get on an airplane. Certainly don't live in Colorado. You get more radiation for so many other things. So the radiation that you get during a screening mammogram is a very low dose. And it's comparable to flying from Charlotte for me to come see you out in California, right? Like, it is just not enough radiation to cause cancer in my lifetime, for
And
sure.
there's people that have been diagnosed with breast cancer their first time getting a mammogram. So they've never had a mammogram before, yet they have breast cancer. I
Yeah.
always try to the way my mind thinks of it is, yes, there's radiation, a very minuscule amount of radiation when you get a mammogram done. But the chance of you getting breast cancer from a mammogram is way less than you getting diagnosed with breast cancer without you could be in a very late stage of breast cancer and not know it because you did not get a mammogram.
Exactly.
And now you're in a very tough position.
Yeah. And now you're getting potentially radiation at a much heavier dose to treat that cancer that could cause other problems for you. It's a risk benefit, which a lot of people I don't think fully understand the risk benefit. And when we talk about that in healthcare, but the risk benefit is really looking at what's the risk. Yes, you're getting some radiation, but you're getting this radiation at age 40. The likelihood of you living to 140 is not there. So the likelihood of this radiation impacting you, this tiny dose of radiation, even if you're getting it every year, this is not the radiation that you need to be concerned about. We're very careful with this in the world of radiology when it comes to children, though, because they do have many more years of life ahead of them. So you will hear doctors say, if we can do an ultrasound or an MRI instead of a CT, they typically will try to do that because a CT has radiation involved with it. But they're also doing a lot of work on the radiologist side at Huntington-Hill imaging centers. They are really focused on right sizing the dose for the person. So if it's a child, the dose goes way down, and they're paying attention to that. And it's always worth asking your doctor, is the risk benefit worth this? Is it worth it for my child to have this CT? Is it worth it for me to have this mammogram? It's 100% worth it for you to get your mammogram. If you can catch it early, you might not even have to have a mastectomy. You might not even have to have chemo. They're catching cancers at stage 0. And that's huge.
Yeah. I know some people don't want to get a mammogram or, any imaging. I feel like it's very common for someone to be one of those who doesn't like to go to the doctor. I mean, I used to be like that, where it's like, oh, it's probably nothing.
Yeah.
Would you, I feel like when it comes to breast health, some women are just like, I just don't want to know. It's scary. They think, going into the fact of having a mammogram, you know, no one wants to get smushed. I know it's honestly very, very quick. It's not as bad if you've never had one. It's not as bad as people make it sound.
Bad.
But how would you ease someone's mind when they're going to get their screening mammogram? And let's say that they're a callback and now they have a diagnosis. How do you what advice would you give to ease their mind so it doesn't have to be so scary?
So even though breast cancer is a big topic, it's a huge topic during October. It's in our face a lot. The chances of being diagnosed with breast cancer are still very slim. Your chance increases with age and increases because we're women. The older we get, the more likely we are. Same thing with prostate cancer for men. If you are a callback, and there's really only about a 10% chance of you becoming a callback, out of that, there's really only about a 1% chance of those women being diagnosed. Most callbacks are because you've got a calcification or a cyst that's non-cancerous that has cropped up. Something has changed on the image. A lot of women are callbacks when they're first screened for their first time because they have nothing to compare it to. So the doctor has to be very careful to be sure that what that screening mammogram looks like for the first time ever is okay. This is your norm. And they can't tell you another fact that I feel like women don't understand. They think sometimes when they're called back that the doctor can tell them right out of the gate, that's definitely a cancer. No, you have to biopsy those cells, period. You have to biopsy those cells. And look at them under a microscope and have a pathologist who is also a physician look at that and make a determination. But a subspecialized radiologist can look at it and be pretty certain about it not being cancer for a lot of things. And if they think it is, they're going to get you checked for a biopsy. So
I think something that I think could be helpful too is, like you said, breast cancer awareness, especially in October, but I feel like it's something that is really, it never ends because, I mean, they say 1 in 8 women will be diagnosed with breast cancer. But I feel like with that brings this giant sense of community. You know, heaven forbid you have to go down that road. I feel like there's this massive support system, tons of stories that you can hear and, you know, to ease your mind because it's, you know, it's not a death sentence anymore. You know, technology has come so far. Of course, the earlier you are diagnosed, the better. So go get your screening mammogram. Even if you don't feel something, go get checked. Um, and should you go down that road, you have a massive support system. There's
Yeah.
Facebook groups and I mean, just speaking so a little off topic, but my son, 2 at the time, was diagnosed with leukemia. Um, and of course, you're just like, what? I mean, more rare than breast cancer. But I was shocked at how many people, I had people messaging me, oh, my nephew was diagnosed with leukemia and he's 24 now. You know, my son is married with a family now. Like, giving you this peace of mind. It's like, okay, it's not a death sentence. It's obviously scary and not something you want to go through, but should you be there, you have people, even if it's not close family and friends, you have people that become your family and friends that help you walk through the journey, ease your mind, share stories. It's like you kind of become part of a family you never wanted to be a part of, but could never live without now. It's like their family, you know?
Club that you really didn't want to join, but you're part of the club now. So
Yeah.
100%. There's so many resources out there. And for any woman who's facing this and or is scared to get her mammogram because of it, she should know that there are so many people and resources available to support you. Um, uh, you should never feel alone, ever feel alone. That said, I can't tell you how much of a wake up call it was for me to go through this experience and realize all the things that I didn't know. Even though I had been doing this for over 20 years, and understanding so many things about it, there was so much I didn't know. And one of those things was each person's experience is different. I could have the exact same breast cancer, staged the same way, caught the same way as another woman, and we are going to experience different things. It's terrifying to be told that you have cancer. I think the only thing more terrifying than that is to be told that your child has cancer. And there's a lot of people out there. Like, I look forward to Breast Cancer Awareness Month, right? Like, I'm a talker, I'm extroverted, if you didn't get that already. I love to share my story. I love to talk about it. But I know women who don't. I know women who do not want to share their story. I know women who hate October for this very reason. It's terrifying for them to have it in their face all the time, and they much prefer to put it aside and be done with it now that they've crossed that bridge and they're on the other side. So I get that. And that's not wrong.
Yeah.
It's just different. We're all
Right.
different. So
Yeah. So what is life for Katie like now? 9 years cancer free. I mean, I'm sure you still go get your mammograms every year, but
just got
what
my
is life for you?
I just got my 10th mammogram since, well, it's probably been more than that because I was getting them a little more frequently, but my 10-year mammogram, and it was clean bill of health. So, yay, I was super excited for that. And it was a little bit before the November timeframe when I would have had it, but it's just how things kind of space out after you go through treatment with different things. So, life is incredible. I think, one of the things that when I was going through treatment, I remember walking outside at night and breathing in the air, and it just felt different. Looking at the sky, and it just looked different. Things that seem like huge problems to me in the past and maybe have cropped up again are just not nearly as big a deal, because you've been through this journey, and it's a tough journey, but if you take it with the support systems that you have around you, and in my instance, I have a strong faith. That's been an important factor for me. You'll get through it. You come out on the other side and you're a stronger woman as a result. And so now I own my own business. My girls are grown up. I'm enjoying being like friends with them as well as their mom now, and spending a lot of time with my husband and my parents as well as they've gotten older. So it's, there's just a lot of things that I think I took for granted before that I don't anymore.
Yeah. Life looks different. It's just like perspectives change.
Yep. Yep.
Things that were big deals before just don't matter,
Yep.
Yeah. I can totally relate to that. It's like you love harder, you don't get mad as easy. Like
Yep.
I think too, like I mean, I don't really have road rage, but let's Southern California, like we all have a little bit of road rage in us, but like even now I'm like somebody's like cutting me off. I'm like, they're trying, maybe their wife's having a baby and they're trying to get to the
Yep.
hospital. Maybe they have a really bad stomach ache. Like it's
I
just like,
know.
it doesn't matter, like
It's not nearly as stressful as it was before.
right. Well, I really appreciate you sitting down with me and sharing your story with me and with everybody else. Like I said, we've known each other for many years now, but I don't think I've ever heard your full story. So thank you for sharing that.
You're welcome. I'm glad to do it. And I hope that I can be a support or a light for other people. So,
Yeah. Well, thank you. Hopefully, somebody's inspired to go get their screening mammogram because it could just save your life, honestly.
yep, 100%.
Early detection saves lives. That's a saying for a reason.
Yep, definitely.
Well, thank you, Katie. Thank you, everyone, for tuning into the Healthy Image podcast. Please like and subscribe and share with a friend if they find this helpful. Or if you're passionate about screening mammograms, make sure you share. And as always, stay engaged, stay curious, and stay healthy. Thank you, everyone.